You have the opportunity to provide up to 1 minute of public participation. Is there anyone who wishes to provide that in person at this time?
Hi, I'm from the Center of Equitable Family and Community Wellbeing. I'm speaking on behalf of the Child Care Network. Good evening, Chair and Commissioners. No, this is not me. Thank you for including community priority funding partners or organizations in this discussion, and thank you to Washtenaw County for investing ARPA dollars into community-driven solutions. Child Care Network used CPF support through our family support program to help families pay for child or so parents can work, seek employment, and pursue education or job training. Because of the support they provided scholarships and case management services to 274 children and from 182 families, awarding 407 child care scholarships. Families told us this investment created stability and reduced stress. 99% reported they were able to attend a quality child care program. 99% experienced less stress, and 97% believed their child care was more stable as a result of this support. We saw forward movement towards stability. 98% of parents reported at least one indicator of progress toward financial stability, and 38% reported receiving a raise, a promotion, or a better job.
Sir, forgive me. We have a 1 minute cutoff period here, but do you have a sense if maybe this could be wrapped up in the next 15 to 20 seconds?
Yes, this program was obviously very helpful to the Child Care Network. And Annette was sorry that she was unable to attend, but the CPF produced real documented impact for the families and strengthened the stability of local childcare. And thank you for your time and letting me go over.
Thank you, and give our best to Annette and the team at Child Care Network, your valuable community partners. Is there anyone else who wishes to give additional public comment at this time? Okay. Ashley, is there anyone online who's in the queue for public comment?
Chair, there's no one online.
Great. We'll move then to item 3, which is the report from the county administrator.
Good evening, Chair, Commissioners. I have no report this evening.
Great. Ashley, I'll move back to you for the report from the Director of Board Operations.
I do not have a report tonight, Chair.
Wonderful. We'll move then to our discussion item here, and we are fortunate to have with us Dr. Trina Shanks from University of Michigan to present on the Community Priority Fund final report, along with the Equity Office update from Derek Jackson. I'd like to turn it over to Dr. Shanks and preface her remarks with a question. If you would prefer to have the presentation and then Q&A at the end, or if you would like us to raise hands and ask questions as we go.
I prefer major substantive questions at the end, but if there's a clarifying question along the way, feel free to raise your hand.
Sure.
And just want to let you know, even though I'm Trina Shanks, thank you for inviting today, I'm going to have my team start the presentation. I'm going to end. So it's going to be Michael Clock and then Patrick Meehan, and then I'm going to close out, and the whole thing will be about 20, 25 minutes.
Wonderful.
All right, hello everyone. My name is Michael Clock. I work with Dr. Shanks and Dr. Meehan at the Center for Equitable Family and Community Wellbeing. Honored to be here today. So this is the team that worked on the Community Priority Fund work, the evaluation team that you can see at the top. And then we were also in partnership with Dr. Quincy Bloxam of Erase the Divide and the Program Evaluation Group. So this presentation highlights how Washtenaw County intentionally structured ARPA funding to center equity, learning, and long-term impact. On the left, you can see the county's approach, which was designed with the flexibility to support evidence-based practice, with oversight placed on the Racial Equity Office to ensure that equity remains central throughout the implementation. Through the Community Priority Fund, resources were prioritized for the 48197 and 48198 zip codes, not exclusive, but using a low barrier funding model informed by robust community engagement, including over 1,300 surveys, responses, and targeted listening sessions. On the right, you can see how our approach was paired with this evaluation and capacity building. The county partnered with our team to support community-based organizations in documenting impact, strengthening evaluation practices, and producing shared learning and which was reflected in their CPF impact reports. Together, this structure not only documented outcomes, but also positioned grantees for future funding and sustainability. Here we can see what our process and workflow was like. So this was the initial meetings that we had with each organization. This was facilitated by the Racial Equity Office. Particularly wanted to credit Akeen for building these relationships and connecting our team to all these organizations. We then would have working meetings, some on a very regular basis. Often, there was a few organizations that would meet twice a week, but at a minimum, we were meeting once a month with organizations. And this was to build logic models with organizations on their projects, to help them build capacity on evaluation, to look at what they could start tracking and things like that. We also had held group convenings, which I'll speak more on in the next slide. And we'd collected different data and helped with analysis, which then led to their impact statements and then their final closeout that we then generated a report, which will have a link at the end for access. So this is just a little highlight. I can't go into full depth of the activity, but instead of just the individual logic models, we also had done group level logic models. So there was the 5 categories that were identified with CPF. For this activity, we had broken up the categories under that, and we developed a categorical wide logic model for what was happening under CPF, but then also thinking about aspirational visions for what could be happening in the future in the county if things were fully realized. And that activity is seen in that QR code, which we can also share links to as well. And those are also in the report. So the Community Priority Fund supported work across 5 categories, each regarding responding to needs that were amplified during the pandemic. Today, we'll highlight key outcomes within each of these areas. Given the time we have in this presentation, which is limited, we can only offer a snapshot of the depth, scale, and creativity of the work that was led by the grantee organizations. We strongly encourage you to review the full CPF impact report, which includes detailed narratives, logic models, impact statements, and supporting data. Under each organization, there's 2 pages, and in the footnotes, there are links to all of their impact statements and logic models. So for the first category we're going to touch on today is the direct assistance to households. This included 5 organizations: Buenos Vecinos, Women and Men Working for Change, EMU Swoops, Students Food Pantry, Washtenaw Success by 6, and Whitmore Lake Area Human Services, which previously was named Northfield Human Services, but they actually had renamed during this process. Some of the highlights and successes, and this isn't exhaustive list, this is just more of a high level, was $620,000 distributed for rent, utilities, and groceries. This aid was concentrated in Ypsilanti and Whitmore Lake. 32 evictions and utility shutoffs were prevented through coordinated rental support. 891 residents received financial assistance. 250,000 pounds of food was distributed countywide. 20,000 was invested in culturally responsive food options. This was particularly for the MU college campus. And 300 individuals received holiday meals and care packages, and assistance paired with health services and financial empowerment referrals. And I'm going to pass this over to Dr. Meehan.
Good evening.
Forgive me, before you speak, I just got a note that if you could get a little bit closer to the microphone just for folks watching online. Thank you.
Oh, okay. Oh. I've never done this, but that's great. Well, good evening, Chair and Commissioners. So the organizations that were funded through the Community Violence Intervention category included A Brighter Way, Supreme Felons Incorporated, Life After Incarceration, Transition and Reentry, We the People Opportunity Farm, and the Dispute Resolution Center. So some of the, again, high-level successes that these organizations achieved. So they served more than 822 returning citizens and provided services including job readiness, mentoring, life skills, training, and so forth. Of those, more than 80% were successfully kind of achieved employment among those that received those services. In fact, one organization achieved 100% of A Brighter Way services, 100% success rate across 229 mentees that they worked with. For We the People Opportunity Farm, 5 of the 6 interns secured long-term employment after their paid food production internship. 230 participants gained both employment and stable housing. I think that speaks again to Brighter Way's success. One grantee hired 4 participants into permanent staff roles. We had 60+ returning citizens receive temporary housing support in 2024. And the Dispute Resolution Center worked with 50 cases that were diverted from the prosecutor's office to peace circles and community resolution. So the Neighborhood Watch program that Supreme Felons Incorporated initiated contributed to declines of violent crime and firearm discharges in Ypsilanti neighborhoods. They accounted for 885 interactions in the Ypsilanti area. 375 of these were one-on-one. By their own calculations, they had 109 violent crimes prevented through their work. And I think it's really important to just lift up a lot of the capacity building that these organizations did to achieve this level of documentation. Prior to their involvement in the funds they received through the Community Priority Fund, they didn't really have the capacity to track this kind of data that they were doing in the community. There was only one organization that was funded through the addressing housing and homelessness category through the Community Priority Fund, and that was Dawn Farm. So they had 38 people that received recovery and substance use disorder that received stable housing through Dawn Farm's initiatives. They had an average of 187 days worth of stable housing, which is more than 6 months. Of those who received these services, nearly one half not only maintained their sobriety, but also successfully transitioned to independent living. And Dawn Farm was rather strategic in terms of where they chose to locate their housing along major bus routes to help with their clients to achieve employment. And in fact, more than a quarter of them were of those who participated in their stable housing program maintained employment for at least a year. And another quarter earned a degree or a certificate during their residency in the stable housing. The last category I'll talk about is the early childhood education expenditure category, and the organizations funded through here included Child Care Network, which my colleague Jack spoke about, Bottles and Backpacks, and the Foundation's Preschool in Ypsilanti. So as Jack was mentioning from Annette's comments, 730 child care scholarships were awarded. And the impact of those scholarships is hard to even quantify in terms of what it allowed families to do. 182 families were supported through case management and referral services. Foundation's Preschool was able to award 13 new infant and toddler slots to their program offerings to expand early child care access, which allowed for an additional 1,100 hours of safe developmentally appropriate care. Bottles and Backpacks was able to achieve a kind of measurable developmental gains among their participants, including improvements in early literacy and motor skills and social emotional development. Through the funding from the Community Priority Fund, Bottles and Backpacks was able to develop a culturally responsive curriculum, and that also included this advisory committee. The curriculum, the acronym they use for it is STEAM. But also, I'll just note that Bottles and Backpacks, through the funding, was able to award 18 additional seats in their childcare services and 25 additional summer camp spots. With that, I will turn it over to Dr. Shanks.
Thank you, Patrick and Michael. Can everybody hear me okay? Good. So I'm going to talk about the last category, addressing educational disparities. So this includes the Community Family Life Center, Growing Hope, Washtenaw Community College, Hope Network, Family Empowerment Center, Our Community Reads, an innovative kind of arts-based curriculum for preschool called Babalu, the Family Learning Institute, and the Children's Literacy Network. And so for a high level discussion of the impact from this category, over 1,200 students were served through targeted literacy interventions. And the focus was really on vulnerable students. So for low performing schools, children of color, and people who are performing below grade level. And there was demonstrated academic gain through individualized tutoring. So for those who are below grade level in reading, 59% met or exceeded their benchmark reading scores. For those that were below grade level in math, 73% met or exceeded their grade level benchmarks. Over 1,600 youth participated in hands-on innovative learning experience. And some of these were really innovative. So there was cooking and nutrition labs through a community farm. There were movement-based literacy activities in preschool. And then older children were able to do introductory coding classes. And some of them were actually, once they learned, went to teach others coding. There was access barriers reduced through wraparound services. So sometimes there was free transportation to the learning centers. And since some of the students were sick with COVID and were absent, they found a way to do digital tutoring and lesson content through remote learning. There were books and tablets that were distributed to students. There were college and career pathways expanded for older youth. And then one of the community colleges really focused on job skills workshops and soft skills, and then also having an HBCU fair for participation. And some of those young people were able to go out of state to have campus tours at historically Black colleges and universities. And so in addition to what happened for young people, adult learners were also supported through reading circles, financial literacy workshops, and health-focused courses. So you can see all of the good work that was done. And one thing I would say here is one of the things that happened, a lot of training was done. And so hopefully, as we'll talk about in a second, I guess I'll go to the next slide, we can talk about the insights of the CPS summary. So there were a wide range of organizations. So some organizations received very little money, like $20,000, and some organizations received hundreds of thousands of dollars. And some of the organizations were very small, maybe one person and mostly volunteers, and some were older established organizations, some were very new and hired staff because of this opportunity. So it wasn't just one type of organization or one type of support, there was a range. And so because this flexible funding and this community-based funding and focusing on need, lots of different organizations for lots of different things. And so as you'll see, that's good and bad because how to build upon that without ARPA funding is something that may need to be thought about. But it provided an opportunity to weave your county priorities into the work of grassroots serving organizations that were close to the community and were trusted by participants. So rather than being kind of county government that seemed far away, they can actually take the priorities that you guys had, but through organizations that were close on the ground. And there's much that can be learned from what grantees accomplished. This wasn't necessarily well integrated, but if we can create mechanisms to incorporate these insights and successes, then they can continue to be mutually beneficial. So like I said, some of the people that were trained, some of those organizations don't even exist anymore, but all those people have been trained in how to do tutoring. So how can we make sure that that is still used and helpful to the community? And then how can you keep the momentum going? That's what we'll talk about next. When you think about lessons learned, one of the things that it did what it's supposed to do, it expanded capacity reach. So some of the Community Priority Fund enabled organizations were able to scale their services. One quote says the number of people that we're able to serve increased by a factor of over 10. For some, this was their first government grant experience. So it was an opportunity for them to have a multi-year federal grant, which they may not have had an opportunity to do without this fund. Then it also actually helps strengthen nonprofit networks. So through the Community Priority Fund, maybe not at the very beginning, but over time, there were new collaborations, referrals, and shared learnings. Through some of our group convenings, they learned to connect with each other, and they had insights of who else was doing the work and how they can learn from one another. In terms of implications from the future, maybe things that didn't quite work perfectly, but we can do better, the county, if they choose to, can do better going forward, is this idea of rethinking cash flow statements. With the reimbursement-based model, these very small organizations that limited budgets, they had to borrow from their other funds as they were waiting to be reimbursed. And for some, that was very difficult and painful and stressful. And then this idea of pairing funding with capacity building, since everybody was kind of given a contract and kind of expected to be able to work at the same level, but given that all the organizations are at different levels doing some sort of a needs assessment to begin with, maybe some of them may need some help with their analytical systems, their data collection system, their accounting system, so they can report in a way that you want, as opposed to feeling constrained because they weren't at a position initially to be able to do that as well as maybe at the end they were able to with support. Being able to sustain these cross-organizational learning spaces so they could continue to do system-level thinking, system-level working. But the caveat for that is how the funding is distributed is important. Because if you're getting funds just to do the direct work and you have a staff person that's doing all direct service, then who's going to be there to do the thinking and the planning and the cross-agency collaboration? But if that could be worked in as part of the funding model, that is an important part of this work. And I will end with recommendations. And again, the details in the report, and we'll have the QR code again at the end. But one thing is really to be clear about establishing data and evaluation frameworks to clarify success. So for example, if a group is providing food and that's what they're contracted to do, but you have some larger goal about having food in places that are grocery deserts or food deserts, or maybe you're trying to reduce food insecurity in a particular zip code. If people can know that they're trying to do that and they can show the work they're doing, and then you can kind of show in part of your larger evaluation framework that this is the impact that's being had. For example, from the educational groups, some groups may have just introduced young people to learning and reading and books, and just gave them a book and that was all they did. But then the next group that actually did a pre-test and post-test and showed their literacy gains over time, you can show all of that as part of your success and everyone can see they're part of this process, just as an example. Another big thing is this idea of streamlining county grantee communication and reporting. Just because we've been part of the process, we know that there are very specific things that the federal government wanted through ARPA, but to constrain those same reporting requirements on a small community-based organization that didn't have a good data system, that was kind of a mismatch. So figuring out how to streamline communication so that the county gets what they need, the federal government or whatever the other funding source gets what they need, but that's a little more streamlined for participants is really helpful. And then this idea of if we could take the lessons learned and consider ways to launch and design what might be, if you decide or however it goes through, this idea of a Community Priority Fund 2.0. So it may not be with ARPA funding, it may not be the same amount of money, but are there some ways to take some things that are learned and continue going into the future? And that's all we have for today. Our full report is there if you want to scan it. If you want to email us, our email is here, but now we're open for questions.
Dr. Shanks, real quick, I just want to thank you and your team. That was a very helpful presentation and provided succinctly, usefully. Thank you. Open it up for questions. We'll start with Commissioner Hodge.
Thank you, Chair. Thank you, Professor Shanks. This was fantastic. I've been really excited to have this presentation for a while. One thing I wanted to throw out, well, first I'd say that Community Priority Fund was largely impacted my district and Commissioner Somerville's district. So really grateful for the incredible work that all the grantees did. I could see the impact in my community and I could see the impact when the funding has disappeared. So I'm glad one of the recommendations is that we do it again. Towards the end, you'd mentioned that if we were to do it again, here are some of the things that we could learn regardless of the dollar amount. Is there a dollar amount that you feel like would be extremely useful if we were going to do like a round two?
Oh, that's unfair. Maybe I should let Derek, let him answer that. But I would say, given that, some organizations got as much as $1 million, to think about doing it too small means you're not gonna have the same impact, right? So I would say at least tens of millions of dollars if possible. But if that's not possible, making sure that you think carefully and collaboratively with community what they want and what they can do so you can actually make sure it's something that meets needs as opposed to just being an arbitrary number.
Yeah. I want to thank Derek too. Where are you at, Derek? I'm trying. There you go. There you go. Derek had to take over management of this on our end after his predecessor left, and very grateful for your work, Derek, in making this a success. Wish we could put you on the camera, but you're all the way over there.
Come on, you're gonna get.
Yeah, come on up, Derek.
What?
No? Okay. He's going to present later. One other thing I wanted to point out. So this is just a fun fact. The EMU food pantry, I actually have a student in one of my classes this semester who was at EMU and was the student that was managing the program at that time. Yeah, you talked to her. So it's really exciting stuff. Thank you.
Thank you, Commissioner Hodge.
Great. I have a few questions, but I want to get to colleagues first. I see Commissioner Scott.
Thank you very much, Chair. Hi, thank you for being here. I am looking for where it was, I think maybe trying to find it. There were, in the part you presented, you talked about measurable gains, but I think it was maybe in the, like I'm looking, and maybe in talking about expanding early childhood education. Measurable developmental gains observed among participating children, improvements in literacy, motor skills, and social emotional development. And I'm just wondering if we could say more about that, like get in the weeds a little bit with that. Like what were the measurable developmental gains? What were the metrics that were used to determine those things?
Bottles and backpacks. So on page 54 of the report is where we talk about bottles and backpacks.
Okay.
So it says, oh, covering, they, one of the things they did was they had a STEAM curriculum and they had subject matter expertise in science, technology, engineering, arts, and math. And so they created curriculum in those areas for kids. And then, what was the other specific things? That was the main thing. They really focused on those things. If you look on page 52 of the report, and can you pull it up, Michael? You can't? Okay, well, each of these has a logic model. So if you
Yes.
pull up the logic model, you can see exactly what outcomes they were referring
Okay, good, great, thank you. It's on my phone, it's really
Oh.
small. I'm gonna try to look at it right now.
Okay.
Thank you. I love a logic model. That's it for me right now. Thank you.
Wonderful. Other questions at this time? Commissioner Beaman, then Sanders.
Mine is less of a question and more of a thank you. And thank you for bringing this forward. Thank you for highlighting all of the successes. I'm in the education space as well. And so, we know that we can divert children from our prison system that costs us lots of money. If we help them as early as, before age 5. And so this is just such meaningful work. So I appreciate you bringing this forward and showing the results, and, our full understanding of results are going to look different depending on the organization and the program. So thank you.
Thank you.
Thanks, Commissioner Beaman. Commissioner Sanders, we'll go to you.
Thank you for the presentation. I'm not sure if this is a question that I should be posing to you, but I'm gonna just pose it. So for the participating partners that received the funding, do we know what percentage of that funding went to staffing as opposed to providing the services?
Keen or Derek could probably say more than that, but the one thing I would say is each contract was very specific. So some people just got money to give a scholarship for preschool, and all the money went to that, and they had to figure out how to fund it themselves.
Okay.
Some of the organizations, because they didn't get staff funding and the staff didn't get paid, the organization no longer exists. So they
Okay.
got the money for that period, but then when the money went, it really doesn't exist anymore. And so to be perfectly honest, each contract was different. And so some people were able to hire staff with their contract because they had more funding. But for the ones that got really small amounts of money just to, buy a cooler or to, buy food, then they didn't have staff money. So I think it was very different across.
Okay.
But maybe Derek or King could say more.
Thank you.
Mr. Jackson, you're welcome to do that now or during your presentation. Okay. Commissioner Sanders, floor is still yours if you.
No, I'm done. I'm done. And Mr. Jackson can do it during his presentation for the benefit of all of us, or provide us with the data after the fact if time is an issue. Thank you.
Commissioners, any other questions for Dr. Shanks at this time? I have 3 that I'll try and ask succinctly. You mentioned at the start of the presentation some of the benefits in terms of relationships between those seeking service and these organizations being close to the ground. Are there any lessons we can draw from that, in our broader human service delivery? was that because of existing relationships beforehand or physical proximity? Is there anything you think should highlight for us?
Well, I'll make two comments from what I know. From what I understand, during the pandemic, some of these organizations not funded were on the ground doing the work. And so part of the vision of the Community Priority Fund is actually to work with some of these organizations that were already there and kind of help give them the scaffolding so they can actually do the work and grow themselves as organizations. So some of them were already doing the work, and then this provided a mechanism to do it. But one of the things we talked about right before this, because we had a little convening from some of the grantees, is in an ideal world, rather than having very siloed funding, where, you know, one organization gets X amount of dollars to do a very specific thing, if, let's say, the county is trying to think about how to improve community safety or how to improve literacy across the full school district as opposed to just maybe, you know, one after school program, are there ways that you could bring people together and have them collaborate to do things and have funding be around that as opposed to ways things have been traditionally done? So I'm not saying it was all done perfectly with Community Priority Fund, but I think it provides a mirror into maybe what tweaks could be made so that you as the county and these organizations can both kind of get what they need.
And if I'm hearing you correctly, there were sort of pre-existing organic relationships with some of these groups and those needing the services. And so we sort of built on their prior trust that they'd built from the communities. Okay. You mentioned the gaps. When you say gaps, do you have a rough time frame for what that gap was? Was that a few weeks, a few months, a fiscal quarter?
Okay, which part of gaps were you referring to?
One of the challenges for the organizations was the gap between when they would start the work or begin planning for it and get the money from the county.
I think the real point there is the reimbursement model. So if you had to do the work and then show all your receipts and then get reimbursed, that means you had to pay for it up front. If you had the money up front, then you could do the work and then you're not putting yourself in the hole. And so even if the funding was reimbursed in a monthly manner and fairly quickly, and sometimes it wasn't so quick, but if it was, you're still paying it after you've already paid for it. So you have to have the money existing before. And for some organizations that were small, that was really a challenge.
So changing that sequence might be okay. And then last question for me, Dr. Shanks. You mentioned, I think you diplomatically said, when there are federal requirements for paperwork and for documents to ensure transparency, on top of any county requirements, that can be harder for smaller organizations. Is that something where we can default or defer to what the feds are asking, or should we better refine what we are asking? How can we thread that needle in your opinion?
Well, I'll answer it two ways. So I'll tell you what we did in the existing system. So we got introduced to these organizations probably several months after they already had their contract and they were trying to figure things out, right? And so then we worked with them and said, we know what the federal reporting is going to be at the end. So let's make sure when you do your logic models, you're talking about how many people are being employed, what your evidence-based models are, you know, which categories you fall in. We tried to help them align what they were doing with what was required for the county. So that's what we did because we were kind of the intermediaries trying to make this happen. But I think that let's say you're either not working with the federal government or you're thinking about this at the beginning, maybe having a bridge organization to kind of help do all the accounting to make sure all the categories are correct, or maybe helping people get their if they're using Excel spreadsheets or QuickBooks or something like that, figuring out how to do things automatic so it already feeds into the categories that the county and eventually the federal government wants, as opposed to doing it in the back end. So I mean, I think if everyone is clear what the final requirements are, then providing some technical assistance to make it easier, as opposed to having people figure it out or get penalized for not doing it right.
So both method and amount is something we can look at. A method in terms of centralizing that or getting an outside organization, and the amount in terms of being cognizant if you're a 1 or 2 person shop that, you know, there's only so many hours in the day.
Exactly.
Thank you so much. Any other questions for Dr. Shanks or her team at this time? Okay. Thank you for being with us. We appreciate it.
Thank you. We'll stay around for the next part of the conversation too, but thank you for the opportunity.
Wonderful. And for that next part of the conversation, I would turn it over to our Racial Equity Officer, Derek Jackson.
Thank you, Commissioners. I'm gonna be joined by Keen from our office as well. Presentation is coming up. So I just want to make a couple comments about CPF. So Commissioner, we can definitely get you that. We don't have it readily available, but within the contract, it specifies, as Dr. Shanks said, pretty specifically like what it can be spent for. So we can put together a report to show you exactly the percentages. I will say that just at a quick cursory review, a lot of it was just direct service. And I think that's one of the really interesting parts about CPF and how it was designed. Those grassroots, community-based organizations that were really boots on the ground. We just had this convening, as Dr. Shanks said, and learned a lot about the good, the bad, the struggles. And Akeem was instrumental in making sure that that stuff went successful. I think the impact, and keeping in mind that CPF was done in the context of the pandemic, when we all thought the world was falling apart, those organizations were some of the organizations that didn't shutter their doors and were still able to provide these services. And for some of them, asking them to do some of the administrative capacity and functions that were required in the federal ARPA law, which is very cumbersome and difficult. And so there were lots of examples around that. And so we have learned a tremendous amount of how to be the bridge between what county, state, and federal government needs to those grassroots, very impactful organizations. So we'll talk a little bit about CPF in the blueprint today, but I just wanted to stress on that on the heels of what Dr. Shanks, I know it's pretty fast. If you look at that report, it is very thorough and in depth around the direct impact that CPF had, but also the lessons learned and what we might be able to think about using from those lessons in other funding mechanisms of county government. So for example, it was just talked about the lump sum versus invoicing. We heard pretty clearly it's difficult for small organizations who really do great work and have impact to have to front that money up front. They just don't have the cash flow. So that makes some very hesitant to partner with county government. And so to do lump sum funding is sometimes a little bit of a paradigm shift for county government to say, we have a contract with you. You're the expert in this area. We are agreeing that you know how to do this, and we trust that you're going to follow through on this. So that's just one small paradigm shift that can have a pretty substantial impact on how we do funding across the county. But there are many other examples in that larger report.
Derek, forgive me, before you go further in the presentation, are you willing to slide a half a foot to the right just to be closer to that mic for
Oh, okay.
folks
Yeah, we'll
online?
switch
Thank
sides.
you.
We'll go back and forth. Thank you, Commissioner. So we're here to talk about 5 things in particular. You see, it's called the Equity Blueprint. We do want to talk a little bit about the history of the office. Within the policy, it's required for the Racial Equity Office to present to this body at least twice a year. So we want to do, since I've been in this role, the first time we're coming before you officially to present, we want to lay out what the Equity Blueprint is, what we've crafted, and what we've been really researching and assessing around the office over the last year. We want to talk about some of the highlights that were accomplished in 2025, some really good things happened, talk about goals for 2026, and then a few thoughts for the future. So I won't spend a lot of time on this because many of you know it, but the office, yes, I see the chuckles. I love the pictures. Victoria, who's up here, was upset for me for putting her in the presentation, but we all love Victoria. But Victoria, Akeen, Cami, and I are the staff that make up the Racial Equity Office. And it was obviously the commitment of this body years ago, back in 2018, to really focus on dismantling systemic disparities. A lot of times people ask, well, what do you do as the Racial Equity Officer, and what does the Racial Equity Office do? And the easiest way I describe it is really a part of every facet of county government. It is how we look and think about the work that we do, not this just feel-good idea, but it's about a philosophy and the way that we want to embody county government. And so we're going to talk a little bit about those things as we go forward. Again, I won't spend a ton of time on it, but there are a couple of highlights within the timeline of the creation of the office that I think are important. So obviously the foundation was in 2018 when the office was officially created. In 2019 was the first time the Racial Equity Officer was ever hired. And so those seeds of change began to be put into place. But this one is what I really want to highlight on the timeline is that, and it may seem like forever ago that the pandemic hit, but once the pandemic hit, even though the REO office has been in existence since 2018, in some ways we often talk about it still being in our toddler stage because so much of the focus of the equity office went towards the pandemic. So in my previous role, I remember like being out there handing out all those supplies and the mask, and that all was done through the racial equity office. And although it was years ago, we just finished towards the end of 2025, the last contract and reporting process around the Community Priority Fund. So it may seem like a long time ago, but we're just starting to transition back to the original intent of the racial equity policy. And obviously in 23 and 24, something really big and important was done. The Advisory Council on Reparations was set into motion. I won't take up a ton of time in today's presentation to talk about the great work, but there's some really exciting things happening with the Council on Reparations. But there's also began to be leadership transition at that time. So then over the last year, really, we've been assessing, we've been evaluating, we've been talking to department heads and understanding what should we be doing and how we might input and impact the actual equity policy. And so the racial equity blueprint was developed. And then 2026, moving forward, is really about putting equity into action. And so that's really what we hope to get to is like, how do we actualize some of these things?
Yeah, so later on, I want to talk a little bit more how we actually do the action piece and what that looks like on different system levels as well.
So again, just a quick reminder about the racial equity policy. So lots of people forget that there are specific mandates within the policy. Now, because of, again, the pandemic, some of these mandates weren't fully actualized, but we want to get back to really focusing on the core functions of the policy. That being said, now that we're starting to have impact, and we're starting to put things into action, it's also a time for us to think about that policy was created in 2018. There may be other changes to be made, language changes. To date, no changes have been made, but I think we are evaluating and looking at how do we evolve the policy now that we're really getting to putting the policy into place. But I did want to highlight some of the mandates, right? We say in the policy that there's training that staff are supposed to do. We say that we're to do these racial equity action plans for departments, and that we're do these reviews of board actions, which is why the equity impact statements are now in the packets and for us to review. We talk about community engagement stuff and then accountability, having some way to evaluate our action steps as a county and how are we embodying that policy. The intent goes far beyond just the policy. And I know we call ourselves the Racial Equity Office, it's the Racial Equity Policy. So centering race is really, really important, but we do a lot more around equity. And we look at equity from a very, very broad lens around a whole different range of options is what we really look at. So this is the blueprint. Some of you have seen this image, some have not. I've been trying to wait until this presentation to really talk about it in detail. It's hanging on the wall outside the Racial Equity Office. But basically the policy that was crafted by this body in 2018 has three major pillars: individual growth of staff, institutional change of the organization that is county government, and structural transformation of very larger systemic issues. And so you see those three things in the middle. They're kind of color coded. And then along the outside are 13 different programs, projects, activities that if we do those, we really believe we can start to put equity into action. I could spend hours talking about every single one of these 13 because there's a lot that goes into them. So we're not going to do that. We're going to briefly go through a few of them, and then we're going to transition to some of the highlights around what we've done around those 13. So the first is the racial equity liaisons that Akeem has the privilege of really leading that group.
And then are y'all able to hear me or?
Yep.
Yeah, that's fine. Yeah, so going back to the blueprint of how this is laid out. So we look at the individual. So how do we look at equity on an individual level? And then we look at it from the institutional level. So how do we look at equity as Washtenaw County, as an institution? And then structurally, how do we engage with other systems? So the first piece is the racial equity liaisons. So this is a collection of 31 individuals who work for the county. That represents around 15 departments within Washtenaw County. And we meet once a month, led by the Equity Office. And this is a space where we are using these equity liaisons, not to just share best practices, but to also be used as a sounding board as well, and to evaluate and look at the programs, initiatives that we are creating within the Racial Equity Office as well.
So the Community Priority Fund, you just heard a little bit about it. We do have it up here because we really are interested in keeping the Community Priority Fund, maybe not in the exact same iteration as before, but thinking about the Community Priority Fund and those lessons learned. There's some really, really important things that I think we'll dive into at a later date. But so the CPF and keeping that alive and thinking about how we provide funding in the future is a really important piece. Number 3 is about policy evaluation and resolution review. That's one of the things that I'm most excited about, is really looking at those equity impact statements, being able to provide the best information possible to you all so you can make the best decision possible for the community. But that's something that we are actively work on. Number 4 is equity compliance investigations. I didn't even realize this was a part of the job at first, but quickly my phone started ringing from community members, from staff. Whenever there is the idea or the notion that someone was treated inequitably and it's related to county government, internally and externally, we get those calls. And so we're in the process of really developing a standardized way to do those investigations, but we have had investigations. So that is an important role to play, to be that confidential, safe space for employees and community members to come to us to seek some recourse or to have some harm healed over time. Number 5 is the Washtenaw Equity Partnership. Some of you were around those tables. WEP had lots of recommendations to transform the justice system that sits within the Equity Office. And so part of our charge is like, how do we take those recommendations and put them into practice? You know about fine and fee justice reform. Advisory Council on Reparations falls into that. Welcoming Washtenaw is another thing that Akeem leads.
Yeah, so I'll briefly share what we are doing in regards to Welcoming Washtenaw. So this is a collaboration with Welcoming America, and it's been tailored for Washtenaw County in particular. And essentially, how do we create and look at policies and systems within Washtenaw County to make it truly inclusive and embracive of all residents who live in Washtenaw County? Where we'll be working with grassroots organizations, individuals, internally within departments around looking at policies, procedures to ensure that all residents of Washtenaw County are welcomed.
So at one point, this was something that was within OCED. It has transitioned to the Racial Equity Office. It is another initiative that Akeem has taken a personal passion to. Again, I won't talk a lot about number 10, which is the Youth Assessment Center. You've heard a lot about that model in the past. One of my personal favorites is the Legacy Project, which is a project that is a combination of the My Brother's Keeper, Our Community Reads, and a group called Black Kids Travel. The whole concept and idea is around genealogical research, helping young people understand their history, and then taking an actual pilgrimage trip to the continent of Africa. So our first cohort is going to start in March. It's going to be adults first who fund themselves. But the whole concept and idea is interdisciplinary learning. It is intergenerational learning. It is about learning who you are, where you come from, and then taking the actual trip. So we are one of the organizations that is kind of helping to put this together. I could talk for hours about this project because we love this particular one. So we haven't done this yet, but in March, we are supposed to start the first cohort that are going to be adults who can pay for themselves to go. So before we ever take a young person or somebody else's young person overseas, that we have the adults work out all the kinks first. But we have a great renowned genealogist who's from Ypsilanti, who's agreed to be our resident genealogist. She is Miss Winborn out of Ypsi District Library, has been on national television doing these things. So she has tremendous stories. But this project is going to be something I think really beneficial that we get to be a part of. And we're pretty proud of that one.
Yeah, and I would really like to invite you all to really take some time to look over this blueprint, because they all truly interconnect with one another. Because when you look at just Derek talk around the Legacy Project, that's focused on the individual. but how does that individual interact with institutions, and how do institutions interact with individuals, and how do institutions interact with each other as well? So these are how we're viewing in the blueprint of how we take on equity at all three levels. And then the last point, the 13th point, the Mobile Support Service Initiative, or the MSSI. This is something where we're going to talk a little bit more later on, but I do want to highlight just a historical piece to it of when it was started. This is something very new. The foundation had to be created. In that first year, there was a lot of community engagement, assessment around what are the needs, because when we go out into community, opposed to community coming to us, what does that look like? And really being intentional and making sure and ensuring that voices from Washtenaw are involved in that whole process. So we took that, and later on, we're going to be talking around, after doing all that assessment, what does it look like being fully deployed?
Wow, I skipped number 12. There's a lot that goes into education, training, and technical assistance for the departments. But so again, you see 13 things here, but there are many subcategories under each one of these. So this, we really believe, is the blueprint of how we actualize the policy within the county. So there's a couple of highlights that I wanted to share that really relate to one of the points around the wheel. So the Equity Fellows is a new project in partnership with the Resiliency Office and the Racial Equity Office. So the idea is that in this first iteration, Milano, who is a major in environmental science and society and political science, is a double major. Jennifer is a major in urban and regional planning, and Jonah is a major in political science out of Eastern Michigan University. Some brilliant young minds. When we interviewed them, I was like, man, when I was a college student, I hope I sounded that smart. But part of their goal is going to be twofold: to help figure out how a resilient Washtenaw plan and the racial equity plan really overlap and work together. And then the other part is specific to you, the board. It is helping us design a process to really have the capacity to review all those resolutions that come in, to look at those impact statements, and to figure out the best way to get you the information to make those really important decisions. So they just started, they're getting oriented. I think Jennifer is in the back here. And so we're just getting going, but just as an example of how we're using the Racial Equity Office as a learning center and a learning institute for people to take what they learn in the class and put it into practice. But this is one of the things we're really, really excited about. And the other iterations of the Equity Fellows, there is the ability for the fellows to be policy fellows in other departments across the county to do the same type of work. Around training, I love this picture, and we just wanted to give an example and kind of highlight experiential learning. So training is such a big part of the racial equity policy, and we wanted to do something different. So we didn't do a ton of training in 2025, but we did want to do something impactful and use that as a jump off point. So Deborah Meadows, who was our kind of tour guide, Scott McFadden in the middle helped, and obviously Debbie Covington, who many of you know, really helped put this together. And so it was an experiential learning opportunity for our team that had 3 primary goals: commitment to racial equity. And it was a huge commitment to take 3 hours and 56 people from county government. I jokingly said on the tour that there was a lot of money from county government on that bus at the time, but that really showed the commitment we had at the highest level of county government. Some of you were on the bus, the administrative deal was there, to take that time out of the day to be there. So 56 attendees from administration, some department heads, commissioners, equity liaisons, and advisory council on reparations. The second goal was really about building empathy and cultural competency. So you can't do equity work if you don't have empathy. Like, you got to care about the people, and you got to have some cultural competency. And so we wanted to move beyond kind of this theory-based understanding of equity that we talk about to a more compassionate, human-centered approach that puts equity into action. And one of the questions we asked afterwards of all the attendees was, did this tour enhance your understanding of the experiences of marginalized communities and the ongoing impact, today's impact, modern day impact of historical injustices? And 89% of them said, yes, it did, or at least partially it did.
Yeah, so promoting collective action and allyship. So a part of the tour, and one thing, if we can go back once more. So for the attendees, the partnership and allyship. We had a very unique experience where not only did we have elected officials, department heads, and also some frontline workers as well through our equity liaisons and community pillars from the Council on Reparations, all there in this collective learning. So that's how we are looking at when we talk about action and allyship and working collectively.
I mean, the other thing is, if you think about the Underground Railroad, it only happened because people who have privilege and power were willing to put their freedom on the line for others, right? And so we use that as a mantra within the tour to be like, all of us, no matter where we sit within county government, have some form of privilege and power. And what if we really use that? We could really start to dismantle systemic racism. And so the question we asked was, how confident are you that what you learn will influence how you approach racial equity work? And every single person who answered, who was on the tour, said, absolutely, this will impact me in some way. So we really feel like we started to accomplish these. And this last picture, I just love the image, but it also shows that this is what training looks like within the equity office, this experiential learning, not just to check the box, do you know the definition of equity, but can you feel it, right? So if you don't know the definition of equity, you know what you felt on that bus tour. You know what the side conversations were. You never forget when you walk out the back door here to go home tonight that 4th Street used to be a Black neighborhood, that the Birkenstock shop used to be the Black barber shop. Like, you understand that in Ann Arbor, we have lost that history and we don't always know that. So whether you know anything about equity, you understand the impact that historical racism has had in Washtenaw County. I want to talk about the MSSI, and again, the images, I think, say a lot, but part of what the Mobile Support Services Initiative is about engaging community. And there are some things like the food gatherers picture in the bottom right was a really serious event where we had to, give out food because SNAP benefits, if you guys remember that. Senator Irwin with his Halloween headgear, and there's a young Elsa on there. So we're out there doing fun community engagement events, but also allowing the woman on the left to be a leader in their community in the Arbor One space. And so the MSSI does a lot, and Akeem can share a little bit more because he also oversees that project.
Yes, and I also want to give a shout out to Victoria because she is the coordinator for the MSSI. And once again, it's a collective effort. So even though you may see us at a barbecue, you may see us at an event, how do you build that trust? How do you build that relationship for when things do happen, they know and they have that trust, not only with the equity office, but as a collective with county government as well, with local government.
So the other piece that the MSSI was out at Arbor One a lot, you'll see some of the data, but it's really bringing attention and services to Arbor One. And so the individuals in the middle of Commissioner Somerville and Victoria are really the folks who are running the tenants association out there. And so with the support of the MSSI and us being out there, the ability for them to take ownership and leadership in their own community. Some of you remember these, right? You were there. These are just some of the pictures that I had in my phone, but we were there to bring government to the people. All of you did a town hall in partnership with the MSSI, and it may sound simple, but the ability to pull up into a park, the ability to pull the basketball hoop out and play with kids outside while their parents are talking to their commissioner, it really embodies bringing government to the people. And I think we have more ideas around how to do that and to do it substantially and over time. But again, the pictures, I think, speak words.
Yeah, so literally meeting folks where they're at. I know a lot of times, especially in social work, that's like a coined phrase of how do you meet folks where they're at? But we're literally taking brick and mortar on wheels and meeting residents where they're at and building those relationships.
I mean, one of the things we've been talking about today, because they, after this, are going out to the point in time study. So Victoria Keene, I think a couple of folks will be out there till 2 a.m. tonight doing the point in time study. But we talked about, we can't do it this year because of the weather and the inability to heat the vehicle because it will freeze. But imagine if the bathroom, which it has a shower in there, internal and external shower, could be used for some of our unhoused individuals. And we can just pull up next to a camp one day and someone could use it. Imagine the MSSI having services from the clerk's office that we can pull up into Manchester so folks don't have to come to downtown Ann Arbor. So those are some of the things that we are looking forward to in 2026. This was another one. I think the pictures just speak a lot. The MSSI was able to be out at Woodlawn. It was the warming space when it was cold. It was the cooling space when it was hot. It was the restroom when there wasn't a restroom out there. And it's also a billboard. It says that Washtenaw County is there. We're present. We're actively participating. So now when people see that, there's some kids who see it, they automatically ask where the pizza is because they're used to Victoria having pizza. But it starts to leave an imprint when they see the big blue bus, the county seal, that government is there, and the county in particular is a part of community and doing some pretty important work. So this is just a dashboard of the MSSI. We started collecting data. We have an activity log of all the services that we provide. There were 138 different events. This data is just from May of 2025 till this month, a couple of days ago. So if you think about it, that's roughly 270 days. The vehicle was used 138 of those days for 138 events. We track how many hours that we're at events. This doesn't include all the prep time, right? Victoria has to do a lot to get that bus ready, fueled, heated to go. Put a lot of documentation and the team and them have to do around the contracting process. So there's a lot to go into it, but 527 hours out in the community, about a little bit less than 5,000 individuals who traverse the MSSI over those roughly 270 days. You can see the locations of where it's been all across the county. Yes, some more than others, just based on some of the events that are going on. And then in the white box, the category, we categorize them in 6 ways: that they are educational or informational sessions. They are food security, like literally handing out food to people. They are direct assistance to families. They might be like an Arbor One kind of a situation. Health and wellness, like a vaccination clinic. Community engagement, like trunk or treat or something fun like that. And then there are these special projects like Woodlawn Cemetery, and you can see the breakdown. I think this is 46 up there around direct assistance. We were at Arbor One 41 times. And so, 41 times.
Yeah.
That's right.
Commissioner Somerville, will you put your mic on?
Sorry about that. We were probably there closer to 60 times because
Absolutely. Yep.
December, January,
Yes.
February, March,
And
April.
it's one thing to be there. It really says to the folks who are struggling that government is here, that we're paying attention, that we're helping to give voice, that empowers them, but also connecting to services. There was an office in the back for an attorney to come sit with a woman who had been, really struggling to get things taken care of in her apartment. And I say that in a very light way, but the pictures were just unbelievable what she was living within. So to have that vehicle there is real impact for individuals. So those are just some of the highlights. Some of the goals, we put them into 3 different categories. We really want to, in 2026, focus on the policy and some of the mandates that are in the policy. So this is about accountability for us as the REO office related to the policy. But goal 1 is really to develop that resolution and decision review. So what's the review process for the resolutions coming before you? So we want to have that codified. Goal 2 is about some assessment. So by the time we come back to you setting up for 2027, we have an actual assessment where we can measure the impact towards the policy outcomes. Goal 3 is we need to get back to doing the departmental action plans. That's pretty specific. Some departments, OCED, public health, CMH just did a great JEDI assessment. So some are already doing the work, but how do we actually have a streamlined and unified process? And then number 4 is about those compliance investigations, having a process for the compliance investigations.
Yep, and then here's some for professional development. So we're looking to relaunch our Lunch and Learn series. We've been using the equity liaisons to provide insight on additions, subtractions, on our approach. And then the other piece is the foundational training. So a training for county staff to update and to be, I think another piece is to be intentional as well on what is being learned and also how it's being learned as well.
So we'd love to have an orientation, a section of orientation. So any county employee that starts, they are getting some foundational pieces related to equity. And then the final piece is like a professional development series. And then these, again, I won't go through all of them, but these are 6 things that are really service expansion. So it talks about the Washington Equity Partnership, the Youth Assessment Center, the Legacy Project, All of those expansions of these programs, I think, are something we're going to focus on in 2026. The final piece I wanted to leave you with was just to touch a little bit on how equity from a philosophical perspective can really be intertwined within board priorities. So you see the 3 priorities that you currently have surrounded by diversity, equity, inclusion, and justice. And how do we start to embody those? In what ways as we think about a new priority setting session? And I just wanted to leave you with, we have a whole bunch of tools in the tool belt. We got some matrices that we've been designing in ways to operationalize this. When we had to look at the budget projects that came before you, we created a matrix of how we score those. So there's a lot of tools behind it, but I wanted to give you just a couple of pieces to really think about as you go into future priority sessions. And maybe it's just a quick equity lens check when you start to build out what those priorities are. And it could be 3 simple questions. Number 1, does the priority center those furthest from the goal? So are we really centering those people who need the services the most? Will the priority address root causes? Like, are we actually moving the needle on some of these really difficult systemic challenges? And then the third is just, does the priority allow those closest to the problem to be a part of the solution? So a big part of equity work is really engaging with, and I know that's a part of one of your current priorities is like community engagement, how you engage with residents. But a big part of equity work is really listening to the people who are closest to the problem, who often know and have really good insight on the solutions. So we could talk forever about all the different ways we might evaluate some of the decisions and priorities, but I wanted to, with this opportunity, just give just a small little nugget that as you're going through these conversations, these might be 3 questions that you could ask in those deliberations. And then finally, having an equity perspective that we don't just want to provide services, but we want to intentionally set priorities to dismantle the institutional and structural barriers that currently predict in Washtenaw County that success sometimes is based on race or geography or zip code. So the ability to set priorities that could really start to break down those barriers could be very impactful. And with that, we are happy to answer any questions. And we thank you for the time.
Well, thank you for the presentation, and I'll get to questions, but our Administrator Dill wanted to provide a quick comment before we do.
Yes. Thank you, Chair. If we could go back, and perhaps you can't bring it up, this slide that shows the Woodlawn Cemetery.
Yes.
That is really powerful for me because I can look out my kitchen window and see that sign. And I've lived in that subdivision for over 30 years. And for most of us in that sub, and there are about 200 homes, we never knew it was there. And when you talk about this, we're talking differently about our community now, the significance of our community thanks to this work. So I just wanted to say kudos to all of you and everybody that participated there. That is phenomenal work.
And just remember that you all funded that work, right? So there's resources from this body to actually continue to do the work, not to mention just the staff time of Victoria Keene in particular, who've been out there supporting the work. And this is why I think the pictures are really important. You can tell by the looks on their faces how emotional of an experience it is to be out there and to have family members who are there. So the gentleman in the bottom left was trying to find his uncle who his family knows are there, but they just don't know where. One of his aunts remembers being at the funeral because his uncle died at a very young age. We had a gentleman who walked up who said, my granddaughter was buried there as an infant. We thought the cemetery only went to a certain spot, but he was like, nope, I remember we were over here somewhere. And so the impact of the images on the faces, you see the top middle, she's literally bending down, looking at one of the graves, trying to help that gentleman to see if that was his uncle. So he has since found his uncle was there. But that's powerful, powerful work that people don't forget because it's such an important impact on their lives.
And I'd like to add really quickly too, the MSSI played a pivotal role in just even providing a space to have those conversations to unpack. Oftentimes, there's even one elder that lives in my neighborhood who stopped by, who wasn't able to help physically, but wanted to watch and look at what was going on. And to be able to sit down, have a conversation, and just to be heard and to share their story. These are the things where we were talking about impact. We try to convey as best we can with photos and sharing those stories as well.
But equity is about healing and repairing harm. This is repairing harm. And so this body should know that you're a part of that, right? From funding it to letting the MSSI exist to doing that work. This is a reparative process that you physically get to see. So thank you, Administrator Dale.
Thank you. We'll go now to Commissioner questions. Start with Commissioner Hodge, then Somerville.
Thank you. I've got about hours worth of questions for you. Ready? If you want to bring that slide back up real quick, because I was going to reference that one. I know, just when you took it down. Thanks. I just want to put another plug or co-sign what you said about how important it was to have the MSSI there. I was there that day and it was rainy. The MSSI being able to have the awning provided shelter for people, and it cleared up eventually, but it was still a wet day out. So that was fantastic. I wanted to point out this slide though. The person in the upper right, if I remember correctly, he drove more than an hour to come to this event. And I think he did end up finding his relative while he was there. So to be able to see that and to know that we're supporting that kind of work is really important to me. And I'm glad that you're leading on this. Both of you, really grateful for your work. Now for my hours worth of questions. Let's see. You mentioned the equity liaisons and the number, I think you said like 31 people in the equity liaison group. Are there any departments that have not assigned an equity liaison?
Yes, so as of right now, we have 15 departments represented. I believe we have 30 departments in general, in total.
So half
Yeah.
have done it. What can we do to be more supportive of your efforts in getting liaisons from every department?
It's a good question. I will say that we did talk to the department heads and we got an influx of people. I think once people started to see it was reinvigorated, that there was going to be not just meetings, but we're really using them as the brain trust of equity work within the county. So for example, having someone from purchasing who may not think about their everyday work as being around equity or inequity, but can understand how purchasing processes work in the fine print, can say, wait a minute, we should probably look at this policy and how we do this. Once people started to see that, like, literally you could be a liaison and there's some oomph behind it, they helped craft the blueprint, they got to vet it, those things. We are honestly starting to see more people join on in more departments. Some of it, I think, is just us just asking and saying, like, we really need someone and here's why. And there's value in having you around the table. And you're not just coming to a meeting. I've been at the county now with my gold pen for 20 years. I've been a liaison for many different things, but how do you make sure being a liaison is really worth your time? And that's on us, to create an environment where it's really worthwhile to be a liaison. We haven't had anybody say, I'm not interested. We haven't had a department say, no, we don't want our staff to participate. It's more of us putting in the work to make sure it's worth their time.
Yeah, okay. I know you said you could talk for hours about any of the 13 items on the blueprint, but could you just talk a little bit more about the Legacy Project and then you specifically, your passion for family trees and how that plays into this?
Yeah, this is probably gonna talk forever. I was young at a family reunion and we called her Aunt Sally. One of the elders in my family was holding council around a picnic table. And I just happened to walk up to talk to my dad and she was telling our family history and I was hooked. So I've become the family historian and doing genealogy for, years now. And the first time I saw the Jackson surname in the 1800s, like I got chills and I was like, I get it. And then when I learned that, as Black folks in America, prior to 1860, we weren't listed by name. We were listed like cattle, one male, how old it was, and that was it. So our names couldn't show up until the 1870 census. But I was able to track some of my personal family back to when they were enslaved and found out who the enslaver was and got his will and seen my ancestor there. It changed how I thought about my family. Not just history, that we were just slaves, but like folks were actively fighting for freedom and doing some phenomenal things and were illiterate and all kinds of, really awesome things. But it gave me a sense of understanding like what the Jackson surname is. And so the ability to share that with people, there's something life-changing. Some of our young people don't even know their biological parents, let alone their historical roots. So it's about that. And then the traveling piece was, again, I use my personal story. I hadn't left my neighborhood or the state of Michigan until I was in high school. And so to see that my neighborhood and those 4 blocks around my house were just a small piece of the world and the world was much larger, it is literally what convinced me to go to college and wind up here. So combining those 2 worlds of genealogy research to find your ancestors with travel, there's a group called Black Kids Travel. There are a whole bunch of young 20-somethings that travel all over the world. They're pretty famous on Instagram and social media, but they're partnering with us to do all the travel and leading. So we have young people leading the elders on these pilgrimages. So that's a little bit of where the idea and the concept comes from. And it really is about helping people learn to be world travelers and global citizens, doing intergenerational work, and also understanding your history and your legacy.
I appreciate you sharing that. All right, 7 more questions, not actually 7. So you mentioned, I'm gonna ask you a similar question that I asked Professor Shanks, but you opened the door to it based on what you said about CPF. If we were gonna do it again, you said we wouldn't want to do it exactly the same way. How would you think about us doing it differently? And do you have a dollar amount in mind?
Lump sum funding. I think that's the number one thing we hear, instead of doing invoicing after the fact. How do we set up a contract and provide the resources ahead of time? And we can still prove that they did, the service. But again, we trust them. We're contracting with them. They're the experts. So I think lump sum funding is a piece of it. Also, relevant and intentional reporting processes. So we're not asking a whole bunch of information just to get data that we'll never use, that it really is talking about the impact of the organizations, and it helps the organizations share their stories so we really see and feel the impact. Data is important, reporting is important, but how we craft that could be done in a much more equitable way. So those would probably be the 2 things that I would say first. Any other additional ones you can think of, Hakeem?
I would add capacity building, like technical assistance, being very intentional. One thing that Dr. Shanks and her team shared was all the CPF awardees are at various levels. So literally, like the MSSI, meeting those organizations where they're at and saying, how can we build up from where you're currently placed?
And as far for the dollar amount, honestly, I think it'd be inappropriate to just throw out a dollar amount. I will say this, we can do an analysis though and look at it. We have one organization who you all funded tremendously. They did phenomenal work, and that impact is still going on, but because that funding has gone away, their capacity to do the work. And it's gonna have, I really will say this, it's gonna have major implications for community violence in our county as a whole. So I think it makes a lot of sense to think about how we invest in that. But the exact dollar amount, I do not know at this point. We haven't done that analysis. We are internally within the Racial Equity Office. I'm one that likes to show it, prove it, and then, ask afterwards. So we have put some of our Racial Equity Office budget into what we're calling CPF 2.0 or 1.5 to really seed fund and do some smaller projects, to really see how lump sum budgeting works, to really see how this different reporting structure works. So when we do come back to you all with a larger plan and ask, it's really based in some fact.
Okay, last one. Thinking about the 13 items on the blueprint, what, if any, support do you need from us to make those a success?
Well, we're talking about the Youth Assessment Center, so that funding for that was important. We'll be coming back before you to actually create the position for the project manager. We cannot accomplish all those 13 things in 1 year. We can't accomplish it with just our small staff. The capacity just isn't there. Even reviewing all the resolutions, like there's not the capacity for us to sit down and review every resolution and do it justice to what you need. So I think some of it is over time, we'll understand what we really need to be successful in all these different areas. I think the will to really want to push these things forward, that's the biggest thing. The support to say like, no, this is important. The support to say, like, let's do the legacy project. To say that we want to do Welcoming Washtenaw, even in spite of some of the things that have happened around this area, even as early as yesterday around immigration enforcement. So having that political will, I think, is the number one thing. And then there will be ask, I think, in the future, if we really want to do it effectively and impactfully, we really got to be willing to invest in it. Not all of those have a full thought out strategic plan where I can say to you, here's what we actually need today.
Yeah, well, I'll just say all of those are important and I support it, since you want to make sure people are saying they support it.
Thank you.
Okay, the last thing I'll say now is I want to congratulate you on your 20 years of service to Washtenaw County. You mentioned it slightly there, but that you got the pin today, I believe, right? That to recognize your 20 years of service.
People are like, how are you here for 20 years? I was at the clerk's office first, then the sheriff's office, and now I'm here. So 20 years I've been here at the county. So yes, thank you very much, Commissioner.
No, thank you for your service to Washtenaw County.
Thank you.
Yeah, I'm smiling because I remember Deputy Clerk Derek Jackson.
That's right.
Commissioner Hodge, is that all for you? Go to Commissioner Somerville.
Thank you, Chair. Thank you to the whole team, including Cami and Victoria who are in the audience. I, I knew that the number was probably high for the amount of times we were out at Arbor One, but I didn't quite realize how many until you said the number, and then I'm adding up probably the days before you started counting. And so I know the residents really appreciate it, but I just want you guys to know how much I appreciate it because it has felt very lonely on days dealing with Arbor One. It's been really great to be able to like trust staff support, which like I haven't always been able to do, which is a personal problem because I do constituent services, like that's part of my day job. Like even recently, I mean, we've been going at this for over a year now. And whenever the tenants need something, I feel like we've been able to respond. And I've also had to experience defending the racial equity office and the mobile support service unit to people who criticize like the need. And what I know for a fact is that many of the tenants at Arbor One who don't have transportation or don't have trust in the system wouldn't even have been able to gain like that first access point to like what their legal rights are in housing. And so I just want to uplift like the ability for us to connect with residents. A lot of folks have mistrust in government right now for really good reasons. But I have felt like our presence, not just at Arbor One, but at other places in my district has helped kind of bridge that gap and gain a little bit of trust with folks in the community who rightfully like don't think that we're actually there to help. So it's made a huge difference for me personally, but I know that the tenants and we also, I mean, being there as much as we have been, the folks that live there have been able to really take control of their tenants union, which like on days that we can't be there, they're showing up for one another. And so I just think it's been a really good experience.
Absolutely. Thank you.
Yeah.
Great, thank you. We'll go to Commissioner Scott.
Thank you very much, Chair. Okay, so this is the Legacy Project. I love this. Speaking as somebody who went on her own little legacy project when I moved to Ireland as a young person, and it was part of that. But do you know, is Professor Henry Louis Gates still doing his show, Finding Your Roots? Okay, can we get him to come here to be part of this? I have visions in my head of him talking to like these young people who are involved in this and like, and just talking about the impact of that in their life.
I would love to see that happen. I think Miss Winborn has been on that show, or at least a part of helping
I
people.
think she
do
might
some of
have
this.
been,
Yeah.
yes.
And so, so yes, I think that would be great to be able
Okay.
to have him and folks. And even when our young people, when you get to hear Miss Winborn, she is such an elder with so much history. Yes, I think that would be just really empowering for them.
I think so. I mean, and I just think it like how many communities are doing work like that
Yeah.
to empower people and to understand that. I think it's something I feel like Dr. Gates would love.
Yeah.
It doesn't need to be on the TV,
Yeah.
but for him to come also and to talk about that, I think would be pretty darn cool. I am also wondering if we can get those questions that you proposed printed for the retreat for when we're thinking about those things. I see Ashley nodding because I think those are really important. And I also, I want to see the work that you and the Racial Equity Office, all of you in that office is doing is so important. I want to think about how, when we go forward, we're embedding that work at the very highest level of our organization, including within leadership. And I think myself, the way I'm thinking about it is that equity can't live in only programs or departments. It has to be reflected in how all of our decisions are made across the county and thinking about who's at the table. And I want to continue to think about the REO and how leadership models those values across the organization and how we can think about how we have REO as part of leadership. So definitely something I want to think very concretely about in this coming year, about how maybe the structure of that office
changes to be more embedded in the entire institution. That's it. Thank you.
Thank you.
Go to Commissioner Robbie, then Commissioner Sanders.
Well, I'm going to keep it brief. Just want to thank you and the whole Racial Equity Office for all the work you're doing. Fantastic presentation. You guys obviously, have your work cut out for you, but you also have accomplished an incredible amount already. So thank you for your work and for your leadership, Director Jackson. Appreciate you. I did also want to sing your praises, Akeem, while you're up here, because while we're in this time of crisis around the immigration issue, you very much stepped forward and were responsible for setting the foundation for the resolution that we passed the other night. And so I just want to celebrate you as a major part of the Racial Equity Office, along with Director Jackson. And thank you for the work that you did on that and really jumping into that and being involved in those meetings and discussions. You're just a phenomenal person, and I just want to thank you for all the work that you've done for the organization.
Thank you, absolutely.
We'll go to Commissioner Sanders.
Yeah, we should give him a round of applause too.
I don't think it's a secret how much I care about the Racial Equity Office. And you can't show that beautiful blue RV without getting a comment from me, even though we've had some hiccups with it and are still having some hiccups, the fact that it was designed the way that it was has allowed it to continue to be useful and serve the purpose for the reason it was created. So I just want to thank the team. Even though Victoria gives me a hard time every single time she sees me, I probably would say she's one of my favorite hires. I was able to sit on the committee for. And I think she's done a great job. Your office has done a great job.
Thank you.
But when you end up being sort of the solo out front ambassador for an initiative, as she has as the driver, who I think basically has never missed a day, in 2 or 3 years, that's a big deal.
Yep.
So I want to say thank you for that. I did want to ask, is it optional for departments to have a liaison? And if the answer is no, why is only half of the offices signed up? And before you even answer that, I want a list of the ones that are not signed up. I'd like to know who they are and if they have a reasonable explanation, fine. But if it has anything to do with the fact that we need a racial equity office in the first place, that's gonna not sit well with me.
Administrator Dill made a physical movement towards the microphone, and so I wanted to.
Yeah, and certainly Derek, you and your team can lean into this, but I guess the short answer is we haven't had enough conversation about it. We haven't said that it's optional. We have tried to make sure that people will come along with the work and do it in the most appropriate way. Certainly at some point, we may need to pivot and change our strategy around it. So please, you guys layer as you see fit, but just wanted to add that piece from my seat.
And again, I really do want to stress this piece. I think once we said, here's how we're going to use the equity liaison group, and once we put out to the department heads, we have had considerable increase in the number of departments. So I really do think we're on this upward trend. And so I think if we get to a couple more months down the road and we still have some holdouts, that might be a different conversation. But I do think now that it's being used a certain way, there's some excitement around being a part of the group, to be honest. And we run out of time like at every meeting, right? There's not enough time to get through the stuff. So I don't think we're there yet, but we can definitely get you a list.
Well, I know that you were delayed. This little thing called COVID might have had something to do with it. So I'll hold my wet noodle for a couple of months, but not much longer.
Gotcha.
Okay, thank you. And thank you for your work.
Go to Commissioner Beaman.
Thank you, Chair. I also just want to lift up the work and all that you do. As the commissioner, I also have to often defend the office, which is ironic when support is so needed. And I can say the first time that MSSI came out to Manchester, I had a resident point at it and say, how do I sponsor that?
Mm.
How do I donate? And I said, well, I'm like, your county tax dollars are already in there, so you are supporting it in a way. They were just so excited to see that available to them. But I also just, want to lift up the help that I've had from all of you, Victoria, Kim, you director, for the issue that we're having in Saline that was similar to the Arbor one issue, though it moved a bit faster with some destruction that's been happening there. But it was just so welcomed and so needed. And to your point of letting people know that it's there on our second trip to Saline, there was a woman who was too nervous to speak to us at the door, but was willing to come out to the MSSI and have a conversation about what was happening, as she was very scared about the situation. She hadn't received anything around eviction, but she had received that she was changing from an annual lease to a month-to-month, which would end in 30 days. So she was very nervous, and again, that mistrust of government, but knowing that it kind of came on her terms, it was in her parking lot of her apartment complex. She made the choice to walk up those stairs and have that conversation. Just meant so much. So yes, I can't thank you enough. And in terms of the legacy trip, this like really hits me today because I was lucky enough to hear the author, Steve Pemberton, who spoke at my day job for a MLK event that we had after the fact. And for those of you who don't know, he's an author. Wrote a great book called A Chance in the World, about how when he was a year and a half old, he was told he wouldn't have a chance in the world. He is in a legacy, if you will, he even called it that, of being an orphan of 3 generations. So he was an orphan, his father was an orphan, and his grandfather was an orphan. And so being able to, when he was an adult, get his case file, get some information that he'd never had before. He always was in the foster care system. He never had a home. He never had parents. And so just what that meant to him, being a Black man, it was just incredible. So I so truly appreciate this and can't wait to hear everything that comes out of it.
Thank you. I have a question and a comment, but I want to afford Commissioner Light an opportunity if she has anything. Thank you for the presentation. Thank you for the work. Commissioner Sanders mentioned the MSSI, and I want to appreciate her work actually prior to being a commissioner to make that happen. Well, yes. But I also want to appreciate Felicia Brabeck for her work in the aughts, as the youth talk about, for her work getting the REO ordinance up and running and so forth. And my question then is sort of along those lines, that this has been an iterative process. We have responded to external events, and specifically with COVID, REO became essentially a human services delivery coordination mechanism. And I know we've sort of gotten back to some of the theoretical work that we're going to do with it, but we are beset in this moment with a new threat as it relates to federal raids around immigration. And so the question or the thought to plant, I had a provider text me today asking about the notion of a way in which we could set aside and expend resources to try and provide services to people so that they can stay in their home, so that they don't have to have those excess interactions with federal authorities right now. And so I raise that not necessarily to say, hey, get on it and fix it, but rather to plant that seed. And obviously, sadly, that's primarily in the context of dealing with systemic racism and overt active racism from on high right now. So I raise that just to add it onto the plate and just say, if there are ways you think this body can support that work and support it in real time and sometimes support it after the fact, I hope you would let us know.
Yep, absolutely. And you know, our presentation does lean heavily into theoretical, getting back to the policy, but I do want to just say that that's always at the core of who we are, is you know, the folks who are out there in the streets doing the work. And so to your point, absolutely would get engaged in that. I know that Akeem has been engaged as a subcommittee of folks who are really thinking about these issues related to immigration right now. So absolutely, we will be there as well.
Sure, and I appreciate that the staff in particular have done a great job on Arbor One and others where there isn't a blueprint to respond to that. So you've had to respond in real time and then circle back. So that's the hardest work and we appreciate it. Any other questions or comments from commissioners at this time?
I do want to lift up something really quick to your point around CPF. So one of the funding organizations dealt with that issue. And one of the pieces that we wanted to continue with the mini grants, they were one of the recipients out of the light what's going on to ensure that they still have that runway to continue the services to that specific population.
Yeah. Thank you. Great. Thank you both for the presentation. We'll move then to item 6, any items for current or future discussion? Okay. Favorite item for everyone on the agenda?
Move to
I would
adjourn.
entertain a motion to adjourn.
So moved.
Is there support? All those in favor say aye.
Aye.
And we are adjourned.